All right, let's take a look at some specific terms. I'm going to start with the term superior, and I like to use the crown for this because I think about the queen and how she considers herself superior. So she wears a crown on her head, so it tells you superior is going to be up here, and she sits above everyone and considers her subjects or peasants, below her, and they kiss her feet. So they are inferior because they're sort of down here. Okay. And then we've got anterior, which most of you know, but obviously if you think about anterior, one strategy is to think about looking down at ants. That's going to be anterior. It's going to be in the front and down sort of area, right? Cranial is going to be towards the head. Caudal is the tail end. Medial is going to be the middle of the body. Lateral is on the sides. And then one that is often, a bit tricky for people is proximal and distal. And if you're in rehab, this is one that's commonly used. Proximal means proximity, which means it's closer to the core, and distal, just like the name suggests, is going to be distant from the core, right? So your fingers are going to be in distal plane, whereas your shoulder is more proximal to the body. So again, you're going to use these type of words to describe position of the human body. Oh, one more I forgot to mention. Anterior is also called ventral, and posterior is often called dorsal, and you'll see those words interchangeably used.